Most people think that if their kidneys were failing, they would know it immediately. They imagine sharp, stabbing pains in their back, or something dramatic like bright red blood in their urine. But here is the terrifying reality that doctors in the emergency room see every single day. Kidney disease is a silent killer. It doesn't scream, it whispers. By the time the obvious symptoms show up, you might have already lost 60, 70, or even 80% of your kidney function. I'm Lina, and today we are pulling back the curtain on the subtle, easy-to-miss signals your body is sending you right now. Curious, we are going to cover 9 signs, including a few that even seasoned physicians often overlook, and stay with me until the end, because I am going to share a 9-point evidence-based protocol to not just protect your kidneys, but potentially reverse the damage of metabolic aging. If you value your independence in your 60s, 70s, and 80s, you cannot afford to skip this. The first sign is something that most people would never associate with their kidneys: high blood pressure that simply won't budge. You might think hypertension is just a heart thing, but your kidneys and your blood pressure are locked in a high-stakes circular relationship. Think of your healthy kidneys as your body's thermostat for pressure. They manage your fluid levels and release hormones that tell your blood vessels whether to relax or tighten. When the kidneys start to struggle, even slightly, your blood pressure begins to climb. But here is the vicious cycle. That high pressure then physically batters the delicate filters in your kidneys, scarring them further and making the pressure go even higher. If you find yourself on one medication, then 2, then 3, and your numbers are still creeping up, your kidneys might be the hidden driver. The latest research, including the famous SPRINT trial, suggests we should aim for 120/80, not the relaxed numbers many are told are okay. If your medications aren't working the way they should, stop just asking for a higher dose and start asking your doctor to check your filtration rate. The second sign is something you can see in the mirror, but it's not about weight in the general sense. It's visceral fat, specifically the fat carried around your middle, your waist, and your internal organs. I want to be very clear here. This isn't about body shaming. You can have slim arms and legs, what we call thin on the outside, fat on the inside, and still be in the danger zone. This deep fat around your midsection is metabolically active. It pumps out inflammatory chemicals and drives insulin resistance, which acts like acid to your kidney's filtration system. A quick clinical rule of thumb is that your waist circumference should be less than half your height. If you are 180 centimeters tall, your waist should be under 90 centimeters. If that spare tire has been growing even while the number on the scale stays the same, your kidneys are likely under a massive inflammatory load. Sign number 3 is what I call the soapsud effect. Have you noticed bubbles in the toilet that don't go away after you flush? We're talking about persistent, thick foam. Think of your kidneys as an ultrafine microscopic sieve. In a healthy state, the holes are so small that vital proteins, like albumin, stay in your blood where they belong. When that sieve is damaged, protein leaks through into the urine. Protein in the urine is like a smoke alarm for kidney damage. It is often the very first clinical sign that the structural integrity of your organs is failing. If it's happening daily, don't dismiss it as just peeing too fast. It is one of the most reliable indicators that you need a simple urine dipstick test at your clinic. Moving to sign number 4, we have unexplained breathlessness. This is the one most people ignore because they blame it on getting older or being out of shape. You might wonder what your lungs have to do with your kidneys. The answer is everything. Your kidneys produce a vital hormone called erythropoietin, or EPO. This is the signal that tells your bone marrow to create new red blood cells. When kidneys fail, EPO levels drop and your red blood cell count plummets. This is called anemia. Suddenly, there isn't enough oxygen being carried to your muscles and heart. If you find yourself huffing and puffing on a staircase that was easy for you 2 years ago, it might not be your lungs. It might be your kidneys failing to signal for more blood. Now, a quick note. If breathlessness is sudden and comes with chest pain, stop this video and go to the hospital immediately. But if it's a gradual decline in your stamina, look at your kidneys. Sign number 5 is the 3 a.m. wake-up call. Do you find yourself waking up several times a night to use the bathroom? This is known as Nocturia. Healthy kidneys have a remarkable ability to concentrate your urine at night so you can sleep 8 hours straight without interruption. As kidney function declines, that concentration mechanism breaks. Your kidneys start producing large volumes of dilute urine 24 hours a day. While this can also be a prostate or blood sugar issue, if it's a new and worsening pattern, it means your kidneys have lost the ability to rest and are struggling to keep up with waste clearance during the day. Sign number 6 is a heavy, bone-deep exhaustion, what I call 70% battery fatigue. This isn't the kind of tired you feel after a long day at work. It's a feeling that never goes away, even after a full night of sleep. This happens for 2 reasons. First, the anemia we just mentioned means your tissues are starved of oxygen. Second, when your filters aren't working, waste products like urea stay in your blood. This is effectively internal pollution. It clouds your brain, saps your motivation, and leaves you feeling perpetually washed out. If you feel like you're walking through mud every single day, don't just reach for more caffeine. Check your GFR, which is the measure of how well your kidneys are filtering. Sign number 7 is one of the most specific signs, and yet almost no one talks about it: a metallic taste in your mouth or a sudden loss of appetite. As waste products build up in the bloodstream, a condition called uremia, it literally changes the way your taste buds perceive flavor. Many patients describe it as a strange, metallic background flavor that doesn't go away. You might find that you're suddenly repulsed by savory foods, or that you are losing weight without even trying. If your favorite meal suddenly tastes like you're sucking on a copper coin, your kidneys are struggling to clear metabolic waste. Sign number 8 is swollen ankles and puffy eyes, also known as pitting edema. When kidneys can't eliminate enough sodium and fluid, gravity pulls that extra water down to your feet. But pay close attention. If you press your thumb into the swollen area and the dent remains there for several seconds, that is a major red flag. This isn't just tired feet from standing too long. This is a sign that your body's fluid management system is completely overwhelmed. If your shoes are feeling tight every single evening and your socks are leaving deep rings around your legs, your kidneys are asking for help. Finally, sign number 9 is the connection to sleep apnea. If you are a loud snorer or you wake up with morning headaches, your kidneys are at risk. There is a two-way highway here. Sleep apnea starves the kidneys of oxygen during the night, causing physical scarring. Conversely, the fluid retention from kidney issues can cause the tissues in your throat to swell, making the apnea even worse. If you wake up feeling unrefreshed, you are putting your kidneys through a nightly marathon they weren't designed to run. Now, I know that sounds like a lot of heavy news, but here is the part where you take your power back. Your kidneys are incredibly resilient if you give them the right environment. To protect them, you need a consistent protocol. First, monitor your own blood pressure at home and aim for that 120/80 mark. Second, keep your blood sugar in check. High blood sugar is the leading cause of kidney failure globally. Third, focus on losing visceral fat through resistance training and walking after meals. Muscle is a metabolic sink that protects your internal organs. Fourth, be honest about your diet. Ultra-processed foods are loaded with hidden sodium and phosphates that are incredibly hard on weak kidneys. Fifth, prioritize high-quality sleep and get checked for apnea if you snore. And finally, if you smoke, please seek help to quit. Smoking constricts the tiny, delicate blood vessels in your kidneys, starving them of the very blood they are trying to clean. Your kidneys are the silent guardians of your future. They determine whether your later years are spent in a hospital or living independently. Don't panic if you noticed one of these signs, but do take action. A simple blood and urine test can give you the answers you need today to prevent a crisis tomorrow. If you found this information helpful, please give this video a like so it can reach others, and subscribe for more deep dives into your metabolic health. I'm Lina. Take care of your kidneys, and they will take care of you.